Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another classification. There is a classification number 30, beta-lactam antibiotics, or classification of penicillins and cephalosporins. This classification is very important for your GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 29 classification videos. If anybody has not seen previous classification videos, please go in the channel's playlist and watch all the previous classification videos, because they are very important for your GPAT Niper DI Pharmacist exam. And I have not only explained you about the classification, but also another important points from these classifications. They are very important videos. Please go and watch all the videos. My dear students, first of all, you should know what do you mean by antibiotic. So antibiotic is nothing but a kind of chemical substance which is produced by microorganism, which is able to inhibit the growth or kill the microorganism. So antibiotic क्या होता है कि ऐसा कोई केमिकल जो माइक्रोऑर्गेनिज्म ही प्रोड्यूस करते हैं और वो केमिकल दूसरे माइक्रोऑर्गेनिज्म का ग्रोथ इनहिबिट करने के लिए प्रोड्यूस किया जाता है. दैट इज नोन एज एंटीबायोटिक्स. Now we have seen the classification of antibiotics in the previous videos. Now today we are going to see about the beta-lactam antibiotics. So in the beta-lactam antibiotics, you have different class of antibiotics like penicillins, cephalosporins, monobactam, carbapenems, beta-lactamase inhibitors, antibiotics, etc. etc. Basically, what do you mean by beta-lactam? As you can see in this structure, so this ring, 4-membered ring with nitrogen in the ring and adjacent ketone group. So जो 4-membered ring होता है जिसमें एक नाइट्रोजन है और उसके नियर बाय कार्बन के ऊपर डबल बॉन्ड है, मतलब कीटोन है. So this carbon number 5 is known as alpha carbon. So 4-membered ring containing nitrogen with the alpha ketone group known as a beta-lactam ring. Antibiotic consisting this ring is known as a beta-lactam ring. Beta-lactam antibiotics, right? So in that you have basically two important antibiotics, penicillins and cephalosporins. Other also have carbapenems, monobactams, beta-lactamase inhibitors, etc. etc. So what do you mean by penicillins? Penicillins are nothing but the antibacterial drugs or antibiotic obtained from the mold or the fungus known as the Penicillium notatum by the Sir Alexander Fleming in 1921. तो 1921 में अलेक्जेंडर फ्लेमिंग ने ये पेनिसिलिन का डिस्कवरी किया था, राइट. पेनिसिलिन्स का डिस्कवरी अलेक्जेंडर फ्लेमिंग ने किया था 1921 में फ्रॉम द मोल्ड्स ऑफ पेनिसिलियम नोटेटम. तो वहां पे उन्होंने ऑब्जर्व किया था ये मोल्ड जो है, ये फंगस जो है पेनिसिलियम नोटेटम, ऐसा कुछ केमिकल रिलीज करता है पेट्री प्लेट में जो केमिकल बाकी माइक्रोऑर्गेनिज्म को ग्रोथ नहीं होने दे रहा है. केमिकल रिलीज बाय पेनिसिलियम नोटेटम व्हिच इज एबल टू प्रिवेंट द ग्रोथ ऑफ स्टेफिलोकोकस infection. Staphylococcus, that chemical was nothing but the penicillin. That was the first time isolated from the Penicillium notatum. Now commercially penicillins are obtained from the semisynthetic manner. And what is the source for penicillin? Nowadays it is obtained from Penicillium rhizogenum organism, right? Now this is the penicillins, they are the derivative of 6-aminopenicillinic acid. So this is the structure of 6-aminopenicillinic acid. All penicillins are the derivative of 6-aminopenicillinic acid. Now in the similar way cephalosporins are there. Cephalosporins भी वैसे ही है. So cephalosporins they are known as 7-aminocephalosporinic acid derivative. तो cephalosporin जो है वो 7-aminocephalosporinic acid का derivative. Chemical abstract nomenclature is very important because they ask question on this. So what is the chemical name of penicillin as per the chemical abstract? Chemical abstract की तहत कौन सा chemical name है penicillin का? So it is known as the 4-thia-1-azabicyclo 3.2.O heptane. 4-thia-1-azabicyclo 3.2.0 heptane. That is nothing but the penicillins. Another name is there, for example, benzyl penicillin. It is also known as penicillin G. It is nothing but the 6-2 phenyl acetamido 3,3 dimethyl 7-oxa 4-thia-1-azabicyclo 3.2.O heptanes, right? Now penum means what? Penum ring is there. So unsubstituted basic skeleton of penicillins. What is that? It is nothing but the 6-amino 2,2-dimethyl penum 3 carboxylate. So ये जो रिंग होता है जो यहाँ तक का जो रिंग है उसको बोलते हैं पेनम रिंग. So in the penicillin you can say it is a derivative of 6-amino penicillinic acid or it has a penum ring, right? In the cephalosporins you can say it is a 7-amino cephalosporic acid derivatives, or they will have sepham ring in their structure. Beta lactam antibiotics contain 4-membered fused ring through nitrogen and tetrahedral carbon to the heterocyclic ring. So different beta lactam antibiotics कितने होते हैं? There are different beta lactam antibiotics like penicillins. So in that penicillin beta lactam ring is fused with the thiazolidine ring. So ये 4-membered beta lactam ring जो है that is fused with the this 5-membered thiazolidine ring. तो इसके ऊपर भी क्वेश्चन आ चुका है. In the Thynomycins, beta lactam ring is fused with the pyrrolidine ring. So in the clavulanic acid, beta lactam ring fused with the oxazolidine ring. तो जो beta lactamase inhibitor होता है clavulanic acid, sulbactam, tazobactam. So in that beta lactam ring is fused with the oxazolidine ring. In the penicillin, beta lactam ring is fused with the thiazolidine ring. Thynomycin, beta lactam ring is fused with the pyrroline ring, right? In the cephalosporins, you can see over here in the cephalosporins, beta lactam ring is fused with the 6-membered dihydrothiazine ring. 6-membered dihydrothiazine ring. You should know what are the different classification of penicillins. So penicillins are classified in different way. For example, natural penicillins. First one is a natural penicillin. तो ये जो penicillins है वो naturally जो फंगस होता है पेनिसिलियम नोटिकम उससे आइसोलेट किया जाता है. That is nothing but the benzyl penicillin. Benzyl penicillin is nothing but the natural penicillin and it is also known as the penicillin G. तो यहाँ पे penicillin G is the drug of choice in a lot of condition. For example, it is a drug of choice in the syphilis. It is a drug of choice in the neurosyphilis. So benzyl penicillin is a drug of choice in the neurosyphilis. So it is a drug of choice in the various conditions. Benzyl penicillin is known as penicillin G. Now semi-synthetic penicillins, they are modified derivatives of 6-amino penicillinic acid. जो 6-amino penicillinic acid होता है उनका modification करने के बाद में आपको मिलेंगे semi-synthetic penicillins. So in that you have different classes. First one is the acid-resistant penicillins. Acid-resistant penicillins. So they are alternative for the penicillin G. So in that you have phenoxymethyl penicillin, which is known as a penicillin V. यहाँ पे देखो पेनिसिलिन जी मतलब पेनिसिलिन जी मतलब क्या होता है बेंजाइल पेनिसिलिन. पेनिसिलिन वी मतलब क्या है फिनॉक्सीमेथाइल पेनिसिलिन. पेनिसिलिन वी मतलब फिनॉक्सीमेथाइल पेनिसिलिन. पेनिसिलिन जी मतलब बेंजाइल पेनिसिलिन. सो पेनिसिलिन वी जो होता है दैट इज एसिड रेजिस्टेंट पेनिसिलिन. पेनिसिलिन वी. नाउ अनदर फ्रॉम द सेमी सिंथेटिक डेरिवेटिव you have penicillinase resistant penicillin or beta lactamase resistant penicillin. So in that you have methicillin, cloxacillin, dicloxacillin, methicillin, oxacillin, cloxacillin, dicloxacillin. So methicillin, oxacillin, dicloxacillin and cloxacillin. You can remember the names of this drug by just remembering one. MCD, Municipal Corporation of Delhi, right? MCD is a Municipal Corporation of Delhi. That is a methicillin, cloxacillin, dicloxacillin. इसमें oxacillin भी आता है, flucloxacillin भी आता है. Now third is nothing but the extended spectrum penicillins. These two penicillins they are known as a narrow spectrum penicillins. Now extended spectrum penicillins means they will have additional effect on the gram-negative bacteria. Most of the penicillins they are active against the gram-positive bacteria, and some penicillins active against the gram-positive plus gram-negative bacteria. So they are known as a extended spectrum penicillins. So in that you have first amino penicillins. Amino penicillins में आता है ampicillin, bicampicillin, amoxicillin, pivampicillin. Amino penicillins में क्या आएगा ampicillin, amoxicillin, bicampicillin, pivampicillin. All these bicampicillin, pivampicillin, then amoxicillin are the products of ampicillin. ये सब bicampicillin जो है, amoxicillin जो है, pivampicillin जो है, all are the products of ampicillin. Remember what is the major adverse effect of ampicillin? So it causes diarrhea. Major adverse effect of penicillin G, anaphylaxis. Right? You have to remember this. Now in that you have another second part known as a carboxypenicillin. In that you have carbonicillin and another example is there ticarcillin. Carbonicillin and ticarcillin. They are a carboxypenicillins. They are extended spectrum penicillins. Now in the third class in that extended spectrum you have iridopenicillins. iridopenicillin में क्या है piperacillin, mesoxyllin, meslocillin and azlocillin. piperacillin, methicillin, and azlocillin. These are the extended spectrum penicillins. Third class in the penicillin is nothing but the beta lactamase inhibitor. तो ये beta lactamase inhibitor क्या करेगा? So beta lactamase एक एंजाइम होता है, बैक्टीरिया प्रोड्यूस करता है, and that breaks down the beta lactam ring. That opens the beta lactam ring and makes penicillin ineffective. So penicillin ineffective, इसको penicillins भी बोलते हैं. So beta lactamase inhibitors, these are the drugs which inhibit the beta lactamase and prevent the degradation of concurrently used penicillin. So in that you have clavulanic acid, sulbactam and tazobactam. Penicillin basically ये classify किया जाता है according to the source. Natural penicillin आता है benzyl penicillin G. It is a drug of choice in a various condition. Okay, like gonorrhea, sexually transmitted disease, syphilis, neurosyphilis, and toxoplasmosis. Semi-synthetic penicillin में आएगा आपका acetastans, phenoxymethyl penicillin, known as penicillin V. Penicillin is resistant penicillin में आएगा EMCD, Municipal Corporation of Delhi, methicillin, cloxacillin, dicloxacillin, flucoxacillin, oxacillin, etc. Then extended spectrum में आएगा आपका aminopenicillins, carboxypenicillins and iridopenicillins. Aminopenicillins में आएगा ampicillin, amoxicillin, bicampicillin, pivampicillin. जितने भी bicampicillin, amoxicillin, pivampicillin, all these are the prodrug of ampicillin. Ampicillin क्या है? It causes the diarrhea. इसका एडवर्स होता है diarrhea. Next one is carboxypenicillin. In that you have carbapenicillin and ticarcillin, and iridopenicillin. In that you have piperacillin, methicillin, and azlocillin. Now they are known as a respiratory penicillin or anti-pseudomonal penicillin. जो extended spectrum penicillins होते हैं, they are known as a anti-pseudomonal penicillins or respiratory penicillins. Now we'll see the classification again. Penicillins are classified into different types. So class, subclass, and example. Penicillin G and its derivatives or its ester. Class 1 penicillin G and its derivative. In that you have benzyl penicillin, which is known as penicillin G. Question आता है इसके ऊपर. Benzyl penicillin is nothing but the penicillin G. Then procan penicillin G is there. So procan salt of penicillin G to alter the pharmacokinetics of penicillin G. Then benzathine penicillin G. Procan penicillin G, benzathine penicillin G, they are the esters of penicillin G. Now second class is acid resistant penicillin. So in that you have phenoxymethyl penicillin known as a penicillin V, then phenoxyethyl penicillin known as a phenethicillin. Right. Now third class, that is a penicillin is resistant penicillin or anti-staphylococcal penicillin. So in that you have two subclasses. Acid labile, मतलब ये क्या है? Acid से destroy होते हैं. So in that you have methicillin, cloxacillin, dicloxacillin. Acid resistance, तो उसमें कौन सा है? Flucloxacillin. Okay. So methicillin, cloxacillin, dicloxacillin. Acid resistant में क्या आएगा? Flucloxacillin. तो बहुत सारे बुक्स में अलग-अलग थोड़ा बहुत क्लासिफिकेशन दिया है. Fourth class is nothing but the penicillin, which is effective against gram positive as well as gram negative organism. So in that you have ampicillin, amoxicillin, telampicillin, pivampicillin. Now all these amoxicillin, ampicillin, pivampicillin, they are the prodrugs of ampicillin. Now next class is beta lactamase inhibitor. In that you have clavulanic acid, sulbactam and tazobactam. ये क्या करेंगे? जो beta lactamase enzyme है उसको inhibit करेंगे. They are having only limited antibacterial activity, but they will prevent the penicillins from inactivation from this beta lactamase enzyme. Class 6 is nothing but the extended spectrum penicillins, or they are also known as anti-pseudomonal penicillins. याद रखो. In that you have three class. Carboxypenicillin, उसमें आएगा carbapenicillin, ticarcillin. Then iridopenicillin में आएगा piperacillin, azlocillin, methicillin. Then aminopenicillin में आएगा pivampicillin and methicillin. और बाकी ये जो ampicillin वगैरह amoxicillin वो भी इसमें आते हैं. Now last class in the penicillins with the beta lactamase inhibitor combination. तो क्या होता है? beta lactamase inhibitor जो है clavum मतलब sulbactam, tazobactam और clavulanic acid, they are combined together with the penicillin, and that penicillin combination is known as the penicillin with the beta lactamase inhibitor combination. So amoxicillin is combined with the clavulanic acid. So this combination is very much famous. For example, clavum 625, clavum 375, and ticarcillin is combined with the clavulanic acid. So what is the mechanism of action of these penicillins? So penicillins and cephalosporins and few antifungal drugs, fossamycin, cycloserine, bacitracin and vancomycin, they target the bacterial cell wall. बैक्टीरिया का सेल जो सेल वॉल होता है वो टारगेट करेंगे. बैक्टीरिया will synthesize a cell wall. Consists of a peptidoglycan layer. Peptidoglycan जो होता है, that is known as a muresin, is a rigid mucopeptide chain. Mucopeptide chain होता है, that is known as a mucin. That is synthesized from one amino sugar. In the peptidoglycan you have two amino sugar known as a N-acetyl glucosamine एक sugar होता है, N-acetyl uramic acid दूसरा sugar होता है. They are joined together with the peptide. ठीक है, ये दोनों एक में के साथ में होते हैं joint. They are present in the repeated unit in the peptidoglycan. उनका repeated unit होता है peptidoglycan में. So you can see over here this. So this GM. So G means glucosamine and M means N-acetyl uramic acid. So initially during the cell wall synthesis, N-acetyl glucosamine UDP will join with the N-acetyl glucosamine to form a UDP N-acetyl glucosamine in the cytoplasm, right? Then UDPM मतलब UDP N-acetyl uramic acid. So that is joined to UDPG by the enzyme known as EPT. EPT is nothing but the enol pyruvate transferase, or that is inhibited by phosphomycin. Now these UDP, udyl diphosphate N-acetyl glucosamine, is also connected with the pentapeptide. One pentapeptide is there. So that pentapeptide is there. Peptide of your alanine and glycine residues. Likewise this UDPM. So N-acetyl uramic acid, that is also connected with the peptide one. This peptide is made up of this alanine residue and glycine residue, which is formed by these enzymes like alanine racemase and alanine ligase. That is inhibited by cycloserine. There is one transporter known as a bactoprenol. Bactoprenol is a transporter जहाँ पे जो N-acetyl glucosamine और N-acetyl uramic acid along with the pentapeptide, ये तीनों का जो कॉम्प्लेक्स रहता है N-acetyl glucosamine, N-acetyl uramic acid and pentapeptide, ये साइटोसोल में बनता है, इसमें बनता है साइटोप्लाज्म में, and that is transported to across the membrane by one transport system known as a bactoprenol. ये जो bactoprenol होता है BP, so that transport the synthesized protein chain of your N-acetyl glucosamine, N-acetyl uramic acid and pentapeptide. That complex is transported across the cell membrane. Now it is a simple peptide and there is an elongation of this peptide. Okay, now this elongation is prevented by vancomycin. Now after the elongation, once that peptidoglycan is synthesized, that should be rigidized, that should be made strong, there should be cross linking. So that is a cross linked by one enzyme known as a transpeptidase. So पहले तो क्या होता है कि सिंपल लीनियर चेन बनता है आपका पेप्टिडोग्लाइकन का. कैसे बनता है? N-acetyl uramic acid, N-acetyl glucosamine, उनके रिपीटेड यूनिट्स होते हैं उसमें कुछ पेंटापेप्टाइड भी होते हैं. वो सिंथेसिस होने के बाद में वो मेम्ब्रेन के ऊपर ट्रांसलोकेट होता है और वहां से उसका पॉलीमराइजेशन होता है, चेन एलोंगेशन होता है और बाद में उसका रिजिडाइजेशन होता है, उसका पॉलीमराइजेशन होता है, क्रॉस लिंकिंग होता है, एंड बाय द हेल्प ऑफ एंजाइम नोन एज अ ट्रांसपेप्टेज. सो दिस ट्रांसपेप्टेज causes the cross linking of this peptidoglycan layer, and which once there is a cross linking, now that layer is a strong and that layer is a strong and rigid. So that's how there is synthesis of peptidoglycan layer in the bacteria or cell wall in the bacteria. This cross linking is prevented by beta-lactam antibody. That is the mechanism. Peptidoglycan is a bacterial cell wall. Okay, bacterial cell wall is made up of peptidoglycan, and which is made up of N-acetyl uramic acid and N-acetyl glucosamine in the repeated units, also connected with the pentapeptide. N-acetyl uramic acid is also connected with the pentapeptide, and N-acetyl uramic acid and N-acetyl glucosamine, they are repeating units in the peptidoglycan, which is a bacterial cell wall. Right? In the cell wall synthesis, it starts by converting the UDP N-acetyl glucosamine to UDP N-acetyl uramic acid by the enzyme enol pyruvate transferase. After that, pentapeptide is attached to a UDP-M, that is UDP N-acetyl uramic acid. The pentapeptide is found by alanine racemase and ala ligase enzyme. We have seen in the bactoprenol is the membrane lipid carrier which removes the UDP from the UDP N-acetyl uramic acid and pentapeptide. N-acetyl glucosamine is attached, which is carried by UDPG. These events occur in the cytoplasm, and product formed is transported across the membrane by bactoprenol. Elongation is there of peptidoglycan is done by transglycolase enzyme. Strength of peptidoglycan layer is increased by doing the cross-linking. Now that is done by transpeptide enzyme. Now, penicillin binds with this transpeptide enzyme and inhibit transpeptidase. So inhibition of transpeptidase is the mechanism of penicillin. Now antibiotic affecting the cell wall, different antibiotic affect the cell wall formation. कौन से देखो यहाँ पे ठीक है. So antibiotics they will affect the cell wall. वो क्या करते हैं? They will form a bond with the bacterial cell wall. जो सेल वॉल के ऊपर एक्ट करने वाले एंटीबायोटिक्स है वो क्या करते हैं? They will form a एक ट्रिक है आपको याद रखना है. They will form a bonds with the bacterial cell wall. Forms मतलब क्या? ये for phosphomycin. तो ये क्या करता है? It inhibit the enol pyruvate transferase. Now bond मतलब क्या? B for beta lactam antibiotics. So they inhibit the enzyme transferase. Bacterial मतलब bacitracin. It inhibit the dephosphorylation of bactophenol. Okay. Then cell for cycloserine. So cycloserine inhibit the alanine racemase and ala ligase. Alanine ligase. Wall for vancomycin, it inhibit the transglycolase enzyme. So these are the different antibiotics: phosphomycin, beta lactam, bacitracin, cycloserine, vancomycin, which inhibit the different steps in the synthesis of cell wall. तो आपको याद ही रखना है. There is no other option. Now you can remember the acid resistance penicillin by one trick. एक ट्रिक है acid resistance penicillin को कैसे याद रखना है, क्योंकि क्वेश्चन आता है. ये वर्ड का VODKA वर्ड का जो होता है ना, वर्ड का D for penicillin, V for oxacillin, D for dicloxacillin, C for cloxacillin, A for amoxicillin and ampicillin. Or you can remember this by another way. A COVID ऐसा एक टर्म है. A COVID, A for ampicillin, A for amoxicillin, C for cloxacillin, O for oxacillin, V for penicillin, V. You can remember the extended spectrum penicillin or anti-phenomenal penicillin by one trick known as a AACT map. CT map मतलब CT मतलब ये आपका CT होगा, map मतलब A for ampicillin, amoxicillin, C for carbonicillin, T for ticarcillin, meslocillin, and A for azlocillin, B for piperacillin. We see the classification of cephalosporins. Cephalosporins are classified into different generations. उनके अकॉर्डिंगली जनरेशन से ही क्लासिफाई किया जाता है सेफलोस्पोरिन्स. तो फर्स्ट जनरेशन सेफलोस्पोरिन्स. सो अगेन फर्स्ट जनरेशन जो वाले वो भी दो में क्लासिफाई किए जाते हैं. सो दोज गिवन बाय ओरल, दोज व्हिच आर पेरेंटल. तो फर्स्ट जनरेशन सेफलोस्पोरिन्स, तो ओरल में आता है आपका सेफेलैक्सिन, सेफाट्रॉक्सिन. पेरेंटल में आता है सेफाजोलिन. यू कैन रिमेंबर फर्स्ट जनरेशन सेफलोस्पोरिन. देयर इज अ सेफा, CEFA एंड सेफा, CEPHA. तो ये सब क्या है? फर्स्ट जनरेशन. सेफा एंड सेफा they are the first generation, but there is one exception known as a सेफाक्लो. नाउ सेकंड जनरेशन सेफलोस्पोरिन्स, तो इसमें क्या आएगा? जिम आएगा इसमें, सिपिरोक्सिम, ओके, सिफ्यूरो, देन सेफ एंड सिफ्यूरो एंड सेफो, सेफ सिफ्यूरो, सिफ्यूरो एंड सेफा मतलब ये लास्ट वाला सेफाक्लोर, सेफोप्रोजिल, सिपोक्सिम and cephalosporin, cefoxetine. So these are the second generation cephalosporin. Now third generation cephalosporins, in that again you have oral and parenteral. तो थर्ड जनरेशन में क्या आएगा? जीम आएगा. सो सिपिक्सिम, सेपोडोक्सिम, सेप्टिनिन, देन सेप्टिब्यूटेन, देन सेप्टामेट, पिओक्सिल, सिपोटैक्सिम, सेप्टाएक्सोन, सेप्टाजोन, then ceftazidime and cefoperazone. So out of that, ceftriaxone is a drug of choice in case of typhoid. You have to remember this. Fourth generation cephalosporins. So in that you have pine word, PIM, cefepime and cefepyrone. तो इसके जनरेशन के ऊपर क्वेश्चन आता है. You have to remember this. Okay. You can see classification of cephalosporins again. First generation cephalosporins for oral like cephalothin, cefazolin. First generation cephalosporin for parenteral use, that is cephalothin and cefazolin. For oral use, cefatroxyl and cephalaxin and cepetride. Second generation cephalosporins, they are more active in the gram-negative organism, some aerobic organisms, and they are also effective in the Pseudomonas aerogenes. So second generation cephalosporins for parenteral use, ciprofloxacin and cephaloxetine, cephaloxime and cephozetine. Cefoxitin and cefuroxime. For oral use, Cefaclor is there, cefuroxime acetate is there. Third generation cephalosporins में क्या आता है? They are highly active against the gram-negative enterobacteria and some other pseudomonas as well. So is the gram-negative cocci and arrows. So in the day of parenteral third generation cephalosporins like cefotaxime, ceftriaxone, ceftriaxone, and ceftazidime. Oral third generation cephalosporins cefixime, cefodoxime, oxygen, ceftadine, and ceftibutan. Fourth generation cephalosporins resistant to beta-lactamase and also inhibit the Pseudomonas aeruginosa of Staphylococcus aureus. In the day of cefepime and cefepirone. Cefepime and cefepirone. So fourth generation cephalosporins they are only injectable cephalosporins. तो फर्स्ट जनरेशन सेकंड जनरेशन थर्ड जनरेशन में इंजेक्टेबल भी होते हैं ओरल भी होते हैं लेकिन फोर्थ जनरेशन क्या है सिर्फ इंजेक्टेबल है यू कैन ऑर्डर दिस मैजिक बुलेट फॉर GPAT Niper DI Pharmacist. Read 2-3 times before exam and qualify 100% with very good rank. You can see we have very much promising results from past few years. Thousands of students they are placed in the Niper. You can also join our GPAT Niper 2024-25 online course. There you will have live lectures, recorded lectures, subject wise and chapter wise. Study material is also there. And test is also there. Everything is in a 8,000 rupees only. And if you get all in the rank below 20, your fees will be returned in the form of reward. Thank you.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100